What's up, beautiful people? Another day, another study. I like studies like this because it reflects what we do in the clinic every single day. We know that conditions have overlapping risk factors. So, this study was looking at dementia, stroke, and late life depression, and they identified 18 overlapping risk factors for these conditions. Now, when I talk to patients and I'm identifying risk factors, what the risk is for may not matter for each patient the same. What I mean by that is if someone is at risk of developing dementia and stroke, and I tell them only that they're at risk for developing dementia, they may not care about developing dementia or think that they're going to develop dementia or have experienced dementia in a family or a friend. But if they've experienced stroke, they're going to care much more likely about that, or if they're more knowledgeable about stroke or whatever. And so we really have to understand what patients want out of their lives, what they've experienced to know how to best inform them of their risks. And I've seen this personally. I've told this story before where I had a patient with prediabetes and I'm going through the risks that come with that. And when she didn't really care until I got to dementia, and she really cared about that, and that enabled us to flow downstream and implement a plan. But anyway, what did the study find? This study found that of those 18 factors, when they looked at a composite for stroke, dementia, and late life depression, the biggest negative factors associated with that were hypertension and severe kidney disease. Other factors were elevated blood sugar, presence of depressive symptoms, hearing loss, pain, sleep duration greater than 8 hours, insomnia, smoking, and stress. They found the highest protective effects against the composite of those outcomes were in leisure time cognitive activity, so making sure you're doing something that is somewhat cognitively challenging in your spare time. This can be puzzles, it could be video games, it could be whatever. And then high physical activity. Of course, we're a channel who talks a lot about the benefits of physical activity because I love to lift weights and exercise. And then they also found that purpose in life and social engagement, two things that we've also talked about on this channel, were protective against the composite outcome. So you really love to see studies like this because it helps us better connect with patients and helps prevent the devastating consequences of these diseases from happening. And it also allows us to inform patients that these things are not just deterministic, they're not in our genetics. We can take agency, we can take control of our health and influence the risk of these outcomes.